Hello, my name is Cynthia Sabarella. Here I will explain a little about this disease that is often experienced by the elderly, namely diabetes mellitus. Well, I will start to explain a little about this disease. Diabetes mellitus, or DM, is a group of metabolic disorder characterized by hyperglycemia and abnormalities in carbohydrate, fat, and protein metabolism. Pathophysiology, type 1 DM, 5% until 10% of cases usually develop in childhood or early adulthood and result from autoimmune until mediated destruction of pancreatic beta cell, resulting in absolute deficiency of insulin. The autoimmune process is mediated by macrophage and T lymphocyte with autoantibodies to beta cell antigen. Example, islet cell antibody, insulin antibody. Type 2DM, 19 of case is characterized by a combination of some degree or insulin resistance and relative insulin deficiency. Insulin resistance is manifested by increased lipolysis and free fatty acid production, increased hepatic glucose production, and discrete skeletal muscle uptake of glucose. Next, uncommon cause of diabetes, 1% until 2% of cases include endocrine disorder, example acromegaly, Cushing syndrome, gestational diabetes mellitus or GDM, disease of the exocrine pancreas, example pancreatitis, and medication, example glucocorticoid, pentamidine, niacin, and alpha interferon. Next, microvascular complications include retinopathy, neuropathy, and nephropathy. Microvascular complications include coronary heart disease, stroke, and peripheral vascular disease. Next, clinical presentation. Type 1 diabetes mellitus. The most common initial symptoms are polyuria, polydipsia, polyphagia, weight loss, and lethargy accompanied by hyperglycemia. Individuals are often thin and are prone to develop diabetic ketoacidosis if insulin is withheld or under condition of severe stress. Between 20 and 14 of patients present with diabetic ketoacidosis after several days of polyuria, polydipsia, polyphagia, and weight loss. Type 2 diabetes mellitus. Patients are often symptomatic and might be diagnosed secondary to unrelated blood testing. Next, lethargy, polyuria, nocturia, and polydipsia can be present. Significant weight loss is less common. More often, patients are overweight or obese. Diagnosis criteria for diagnosis of DM include any one of the following: 1. A1C of 6.5% or more. 2. Fasting or no caloric intake for at least 8 hours. Plasma glucose of 126 mg per deciliter or more. 3. 2-hour plasma glucose of 200 mg per deciliter or more during an oral glucose tolerance test or OGTT using a glucose load containing the equivalent of 75 gram anhydrous glucose dissolved in water. 4. Random plasma glucose concentration of 200 mg per deciliter or more with classic symptom of hyperglycemia or hyperglycemic crisis. In the absence of unequivocal hyperglycemia criteria, 1/3 should be confirmed by rapid testing. Normal fasting plasma glucose or FPG is less than 100 mg per deciliter. Next, impaired fasting glucose or EFG is 100 to 125 mg per deciliter. Impaired glucose tolerance or EGT is diagnosed when the 2 hours post-load sample of EGT is 114 to 199 mg per deciliter. Pregnant women should undergo risk assessment for GDM at first parental visit and have glucose testing if at his risk. Example, positive family history, personal history of GDM, marked obesity, or member of high-risk ethnic group. Next, treatment. Goal of treatment: ameliorate symptom, reduce risk of microvascular and macrovascular complication, reduce mortality, and improve quality of life. Next, general approach. Early treatment with normal glycemia reduces risk of microvascular disease complication, but aggressive management of cardiovascular risk factor. Example, smoking cessation. Treatment of dyslipidemia, intensive blood pressure control, and antiplatelet therapy is needed to reduce macrovascular disease risk. Next, appropriate course requires goal setting for glycemia, blood pressure, and lipid levels, regular monitoring for complication, dietary and exercise modification, appropriate cell monitoring of blood glucose, or SMBG, and laboratory assessment. Non-pharmacologic therapy. Medical nutrition therapy is recommended for all patients. For type 1 DM, they focus endophysiology, regulation insulin administration with a balanced diet to achieve and maintain healthy body weight. The meal plan should be moderate in carbohydrate and low in saturated fat, with a focused and balanced meal. Patients with TP2DM often require caloric restriction to promote weight loss. Next, aerobics exercise can improve insulin sensitivity and glycemic control, and may reduce cardiovascular risk factor, contribute to weight loss or maintenance, and improve well-being. Pharmacotherapy of type 1 diabetes mellitus. Patients with type 1 DM require insulin, but the type and manner of delivery differ among patients and clinical. Therapy should attempt to mix carbohydrate intake with glucose-lowering process, or usually insulin and exercise. Dietary intervention should allow the patient to live as normal a life possible, and patients receiving insulin should have intensive education in recognition and treatment of hypoglycemia. A regimen of 2 daily injection that may roughly approximate physiologic insulin secretion is split mix injection of a morning dose of intermediate duration insulin and regular insulin before breakfast and again before the evening meal. This is means that The morning intermediate acting insulin provides basal insulin for the day and converts the midday meal. The morning regular insulin convert breakfast. The evening intermediate action insulin give basal insulin for the rest of the day, and the evening regular insulin covers the evening meal. Patient might be start on uh, 0.6 unit per kilogram per day, with 2 treats given in the morning and 1 treat in the evening. Next, intermediate acting insulin should comprise 2 treats of the morning dose and 1/2 of the evening dose. However, most patients are not sufficiently predictable in their schedule and food intake to allow thick glucose control with this approach. If the fasting glucose in the morning is too high or hyperglycemia. Of course, in the early hours of sleep, the evening MPA dose might be moved the bedtime. This approach improves glycemic control and might reduce hypoglycemia sufficiently for patients unable to follow more intense regimen. Treatment of complication. Example, retinopathy. Patient with stabilized retinopathy should be examined by one ophthalmologist at least every 6 to 12 months. Early background retinopathy may resolve with improved glycemic control and optimize blood pressure control. More advanced disease will not fully regress with improved control, and aggressive glucose reduction may acutely worsen retinopathy. Laser photocoagulation has markedly improved sick presentation in diabetic patients. Patients with orthostatic hypotension may require mineralocorticoid or adrenergic agonists. Then diabetic diarrhea is commonly nocturnal and frequently respond to a 10 to 50-day course of an antibiotic such as doxycycline or metronidazole. Theoretic may be useful in unresponsive case. Erectile dysfunction is common, and initial therapy should include a trial of an oral phosphodiesterase 5 inhibitor. Example, sildenafil, vardenafil, or tadalafil.
Assalamualaikum warahmatullahi wabarakatuh. My name is Dermoada. Now I want to tell you about age and cancer. Cancer can develop at any age, but cancer is much more common in older people. Almost 9 in 10 cancer cases in the UK are in people aged 50 or over. And this is true for most types of cancer. This is because our cell can get damaged over time. This damage can build up as we age and can sometimes lead to cancer. The good news is around 4 in 10 cancer cases in the UK could be prevented. Whatever your age, living more healthy can help stop the odds against cancer. Why does cancer risk increase with age? Over time, the cell in our body can become damaged. This can happen by chance or because by things such as air breath, smoke, or UV rays from the sun. Sometimes this damage can be fixed by our body, but sometimes this damage builds up and can cause cells to grow and multiply more than usual, causing cancer. As we age, There more time for damage in ourselves to build up and more chance that something of this damage may eventually lead to cancer. Rarely, a person might born with damage already in their cell that makes cancer more likely. This doesn't mean you will definitely get cancer as you get older. But being aware of your body and knowing what normal for you is even more important as we age. If you do notice any change to your body and this initial or don't go away, this is important to tell your doctor. Don't put it down to age or a different health condition. And whatever you age, living more healthy can help stall the odds against cancer. Things like stopping smoking, keeping a healthy weight, eating healthy diet, being safe in the sun, drinking less alcohol, and keeping active can all help reduce the risk of cancer. It's never too late to make a change. Cancer of the elderly exhibits slower growth because the body already has a slower rate of cell development than those of young males. However, some deaths show that early with tumors have worse prognosis because of delayed diagnosis. Thus, the elderly should learn about the right attitude and knowledge to combat cancer. Older people have cancer little experience in the big older Sarah when little information about cancer was still available. Sona and family experience are of few and concealment and terminal pains are painful and full of suffering. People often ration the emotion and memories and become immune to new information. Therefore, a number of cues of change. Regarding what cancer means today, some things do not arrive as clearly as their own experience, to which they often give the assessment of the only truth. Meanwhile, of people then to label themselves as part of the elderly population, thus anyhow cancer or distress is quickly attributed to old age. This case occurs about of the attitude not only of older people, but also of their relatives and friends, including health staff. Psychosocial reaction to cancer are relative to many personal aspects, including society, culture, education, and family. Age is associated with different ways of coping with the disease. We even that more than talking about age. We should start talking about life cycle because some aspects are not related to the numerical age, but the moment and fate of the personal life. Cancer is a complex disease that must be analyzed from several points of view, and each aspect need to be emphasis for elderly. Attitudes toward and knowledge about cancer in older people. In this study, we interviewed 874 people 60 years of age or older regarding their belief attitude toward cancer. This will finally contain 814 valid survey. This research also provides valuable information for the future related and for the elderly to have the appropriate attitude toward health. Psychosocial barriers. As aforementioned, cancer is not just a physical disease, it is associated with wrong belief due to relation to death, pain, and suffering. Cancer has to do with historical aspects are difficult to suddenly change. This phenomenon is especially true to older people. Possible attribution to cause and cure are often detected. Older people have low health literacy because they come from a time when health was only considered when one was sick and the doctor only decided on what to do. To expect only 28% of our elderly respondents are aware to a greater risk of development cancer. Thus persuading the elderly who experience physical problems to immediately consult a doctor is difficult. Older people often do not recognize the usefulness of early detection of elderly healthy behavior because they consider that attitudes toward prevent and early diagnosis. We found that older people do not have protect attitude and often do not see the need to change lifestyle or to visit the doctor before certain change or discomfort. Although 53% of elderly believe that cancer can be prevented beside on our study, they have little knowledge of the relevant code against cancer. Only 6% of these people claim that they know this code. When asked about some cancer postulates, the figure increased, especially regarding harmful tobacco, 95% and except something 90% about 58% accounted for excessive alcohol intake, 48% for unhealthy diet, and 38% for overweight status as risk factor. Regarding early detection, 74% indicate that it's possible and effective, but 21% confuse it with prevention. Mammography is known as an early detection tool. 84% where only 44% of the samples know PSA, prostate-specific antigen, as a prostate cancer marker. Anti-cancer treatments are sometimes devastating. To the elderly, treatment may not be considered necessary because certain therapies may seriously affect the quality of life, and many consider their age not anymore worthwhile. In our data, 29% of elderly admit that the treatment for cancer is worse than the disease itself, and 34% prefer not to receive any treatment in case of developing cancer. The most preferred treatment is chemotherapy.
Furthermore, for diseases suffered by the elderly, namely heart disease, the cause of disease in the elderly generally come from the body endogenous disease because the elderly have decreased the function of various body organs due to damage to cell, due to the aging process resulting in the production of hormones, enzymes, and substances needed for decreased immunity. There are several diseases that are commonly suffered by the elderly, generally are caused by the aging process, which decrease the function of the body organ so they don't work properly. The diseases can make it difficult for the elderly to carry out her daily activities independently. Entering old age, the body will naturally experience physical change due to the aging process. Aging can affect all parts of the body, starting from the hair, skin, muscle, bones, teeth, and organs such as the brains, kidneys, and heart. These changes can have an impact on the health condition of the elderly. The decline in organ function that occurs with age can cause various health problems. One of them is heart disease. Change in the cardiovascular system cause heart disease. Heart disease is a disease involving the heart or blood vessels, arteries, and veins, with risk factors namely age, gender, high blood pressure, serum cholesterol level, smoking tobacco, excessive alcohol consumption, family history, obesitas, lack of physical activity, factor physical-social, diabetes mellitus, and heart pollution. Heart disease that often occur in the elderly, namely hypertension, uh, is characterized by systolic blood pressure about 160 mm Hg and diastolic pressure about 90 CHD. Or coronary heart disease is a heart disease both total and fatality due to obstruction of blood flow to the heart, muscle, and heart failure. Congestive or chronic heart failure risk factor, namely age, 65 years and above, hypertension, CKD, rheumatic heart, heart disease, arrhythmia, kidney disease, socioeconomic lifestyle. The strength of the heart muscle in the elderly can decrease as well as its function in pumping blood, especially in the elderly rarely exerts signs young of high blood pressure, hypertension, and atherosclerosis. Heart disease that often attack the elderly is coronary heart disease, heart failure, and heart attack. For the elderly who have heart disease, the doctor will provide medicine to strengthen the work of the heart, reduce the work on the heart, and prevent complications. If necessary, the doctor will also recommend heart surgery. Next, change in heart structure in the elderly. The size of a person's heart usually remains proportional to body weight. There is an obvious hypertrophy or atrophy, which means it is not normal, but it is more of a sign of heart disease. The size of the heart chamber does not change with aging. The wall thickness of the left ventricle tends to increase slightly with aging due to an increase in collagen density and loss of function of the elastic fibers. Therefore, aging of the heart becomes less capable of distension, which leads activity control process. Change in the structure of the heart, which are closely related to cardiovascular, result in the decreased ability to function efficiently. The heart valves become thicker or stiffer, and the heart and arteries lose uh, elast- elastic- elasticity as calcium and fat accumulate within the wall of the arteries and veins. Surface areas within the heart that have undergone high blood flow, such as the aortic valve and mitral valve, are thickened and form a protrusion along the valve line. Rigidity and the base of the aortic base prevent complete opening of the valve, causing partial obstruction to blood flow during the systolic pulse. Incomplete deep ventricular emptying occurs during time of increased heart rate, and this suppression of coronary arteries and ischemic circulation. This structural change affect the conduction of the cardiac system, stroke in in ingress in the amounts of fibrous and connective tissue. Next, change in heart function in the elderly. From a functional or appearance point of view, the main change associated with aging in the cardiovascular system is a decreased ability to increase output in response to increased bodily demands. The function of the heart, which is close to its physiological limitation under ordinary condition, leaves little reserve of strength. Cardiac output at rest remains stable or decreases slightly with age. Interesting heart rate also decreases because the myocardium is thick and less tractable, with stiffer valves, increased diastolic filling time and increased diastolic filling pressure are required to maintain adequate preload. An aging heart is also more dependent on atrial contraction, or the volume of blood extends to the ventricle as a result of coordinated atrial contraction. Two conditions that put the elderly at risk for inadequate cardiac output are tachycardia, which is caused by a shortening of the ventricular filling time, and atrial fibrillation, which is caused by the loss of atrial contraction. Next, signs and symptoms of heart disease. In the elderly, the signs that are feeling fulfilled with heart disease, namely find the precordial area supporting a bridge which is actually still in mild drudgery, fatigue or severe fatigue, which after result from a film of soreness of bridge. The symptoms that can occur are consciousness and vomiting. According to Suharto, the signs of heart disease are sudden change pressure, intense pain in the middle of the chest for several minutes, middle of the car several minutes, chest pain can spread to the shoulder, neck and arm, dizziness, cold sweat, nose and vomiting, shortness of breath, of shorter breath, often emotion that disappear immediately when resting or relaxing, post-heart weakness in some part of the body, such as arm, leg, or half of the body, unable to speak and difficulty communication. Then, how to deal with heart disease? Number 1, know the health risks. When you are 40 to 75 years old, you must have routine health checks at least once a year. This examination aims to determine whether there are risk factor for heart disease in you. The doctor will assess the level of risk and inform the specific step for handling it. Number 2, stay active. Daily physical activity can improve the quality and lower your risk of heart disease. Not only heart disease, stroke and diabetes also be prevented by routine physical activity. Number 3, take control of cholesterol. The first step to controlling cholesterol is reducing the consumption of food high in saturated fat such as fried foods, coconut milk foods containing butter or butter, comfort life, multiply, The consumption of fats that are high in omega 3 and omega 6 and fruit and vegetable have fiber. Number 4. Maintain blood pressure. High blood pressure or challenge hypertension can cause disorder of the body organs such as the heart, kidneys, eyes, and other small blood vessels. High blood pressure that is not treated properly can lead to complications such as enlargement of the heart, kidneys failure, stroke, and so and ready to afford. Uh, Number 5, have a ideal body weight, control blood sugar.
Assalamualaikum warahmatullahi wabarakatuh. Let me introduce you to Muti Hafizah, so will explain osteoporosis here. Understanding of osteoporosis. Osteoporosis is a disease when the bone slowly lost its density, making it weak and vulnerable to fracture. Osteoporosis most often causes fracture in the hips, feet, and wrists. Symptoms of osteoporosis. Osteoporosis is known as LANSIA or LANSIA because people do not feel any symptoms until accidents such as slipping or falling cause bone fracture. Cause and risk factor osteoporosis. The risk factor for osteoporosis cover many. Some of when can be modified and other cannot be modifiable risk factor. The sex hormone, low estrogen level are linked to both slow and menopause. Killers can cause osteoporosis is women as from men. Low testosterone leads to osteoporosis that can be modified with change in diet as well as hormone therapies. Anorexia nervosa, the body does not get the for nutrition, so the lacks of the competent needs to maintain a low density of the calcium and vitamin that might cause the bone to become brittle. Medicine controlled by a lack of physical activity, smoking, and modifiable risk factor. Gender osteoporosis is more vulnerable to women than Russia. As their aggressive disease, osteoporosis attack individuals of experimental of and over small and the body size of mammals with cause and Asian diseases have higher risk than Hispanic women and family. Story with osteoporosis. Diagnosis of osteoporosis. A diagnosis of osteoporosis is actually performed by Dr. B. Questioning full medical history and by conducting physical exam, bone erase, testimony, and physical laboratory tests of Dr. Dian bone mass hemi when to from addition test to eliminate possible bone loss including osteomalacia, metabolic bone disease, characterized by abnormal bone mineral. These tumoric bone are also from of women in menopause. Some types of testimony bonds are associated to bone loss in various areas of the body. Is one of the most accommodate but other techniques can allow identify osteoporosis, including bone absorption, spark-cotton, quantitative tomography, absorption radiography, and osteoporosis. Doctor and treatment. Osteoporosis treatment includes a balanced diet rich in calcium and vitamin, relatively healthy life of medicine of needs, estrogen within therapy, sleep, estrogen receptor modulator, calcitonin, and biphosphate. Prevention of osteoporosis diet. A healthy diet of calcium and vitamin is sufficient to help repair the bone. A lot of people get less the left calcium than net. Again, calcium as low-fat milk, yogurt, cheese, orange juice, calcium and brain vitamin C alone net for strong bones. Some sufferers might need to take vitamin D12. The graph on this figure shows the amounts of calcium, the vitamin, the nutrition delta. Lifestyle, the friends, osteoporosis, the smoke less alcohol. That all from me. Thank you.
From 7B. I want to explain to hypertension. Hypertension or high blood pressure is a condition when the blood pressure is at 130 or 18 mmHg or more. If not treated immediately, hypertension can lead to serious life-threatening diseases such as heart failure, kidney disease, and stroke. Blood pressure is divided into systolic pressure and diastolic pressure. Systolic pressure is the pressure when the heart pumps blood around the body, while diastolic pressure is the pressure when the heart relaxes before pumping blood again. Hypertension has the term silent killer or disease that's kill in this secret. This is because people with hypertension generally do not experience any symptoms until their blood pressure is too high and life-threatening. Therefore, is
it is important to have regular blood pressure checks, either independently or by visiting a doctor. In decreased age, especially over 65 years of age, pregnancy, not exercising and doing physical activity, not eating food that contain potassium, have a family history of high blood pressure, suffering from obesity, sleep apnea, diabetes, or kidney disease, consumption too many food, high in salt consumption, too much caffeine, have a bit of smoking, and consuming alcoholic beverages. Hypertension is a dangerous disease because it can occur without symptoms. In fact, in some cases, symptoms only appear after hypertension has worsened and is life-threatening. Symptoms that can appear in this condition include nausea, throw up, headache, nosebleed, hard to breathe, chest pain, visual disturbance, ringing in ears, heart rhythm, disturbance, blood in urine when to see a doctor. Perform regular blood pressure checks to doctor at least every 2 years starting at the age of 18 years. If you are over 40 years old or 18 until 39 years old but have risk factor for hypertension, blood pressure checks are recommended once a year. If you have been diagnosed with hypertension, do blood pressure checks according to the schedule determined by your doctor. You can also check your blood pressure independently using an over-the-counter blood pressure meter. Please note the symptoms mentioned above do not always occur in every hypertension sufferer. Therefore, do not delay checking your blood pressure until symptoms appear, as it can be fatal. Hypertension. Hypertension is a top 5 factor that can increase the risk of developing the disease. Some of the effective ways that can be done are raise and maintain ideal body weight, get regular exercise such as brisk walking or sailing 2 until 3 hours each week. Eat low-fat and high-fiber food such as fruit and vegetables. Limit the amount of salt in your diet to no more than 1 teaspoon per day. Avoid drinking alcohol. Limit consumption of caffeine drinks. Give up smoking. Thank you for my video.
Assalamualaikum warahmatullahi wabarakatuh. My name is Fazia. In here I will explain about Alzheimer, which is a disease that often occurs in the elderly. The first, the pathology. The earliest appearance of Alzheimer disease pathology in the auditory cortex may produce substantial memory decline in the non-demented elder. We may be able to use fMRI techniques to more definitively establish whether memory decline in individual subjects is an early indication of Alzheimer's disease. Then brain may actively attempt to compensate for Alzheimer's disease pathology, producing individual variability in the degree of clinical manifestation of any specific degree of pathology. Our PAT study have begun to provide some understanding on the individual variability in the expression of the network that normally mediate cognitive function. In addition, they have begun to delineate
of the brain may attempt to compensate for Alzheimer's disease pathology. Next, the epidemiology. A defining event of the 20th century was the dramatic increase in life expectancy at birth, an increase of over 50% from under age 50 in 1900 to over age 76 in 2000. With the consequent aging of our population, age-associated diseases have come to the forefront. Of this, Alzheimer's disease and related dementing disorder are the most dependent. It is animals that of all the risk factor of Alzheimer's disease, the biological basis of age the less understood. Next, the impact of Alzheimer's disease. Alzheimer's disease is the most common cause of dementia among people aged 65 and older. Dementia is the loss of memory, reason, judgment, and language to such an extent that interference with a person's daily life and activity. It is not a disease itself, but a group of symptoms that often accompany a disease of condition. Alzheimer's disease is a major public health problem for the United States because it has such a high impact on individual, family, the healthcare system, and society. Scientists estimate that up to 4 million people now have Alzheimer's disease. For every 5 years, a group beyond 65, the percentage of people with Alzheimer's disease double. More than 34 people are now age 65 or older. This number is 13% of the total population of the US. The percentage of people over age 65 will increase rapidly over the next few years as the baby boom generation reaches 65. In addition, the group of people over 85, the group with the highest risk of Alzheimer's disease, in the fastest growing segment of the population. By 2050, 14 million older Americans are expected to have Alzheimer's disease if the current number and no preventive treatment become available. Slightly more than half of those with Alzheimer's disease are cared for at home, while the rest are in the various kind of care facility. A recent study estimates that the annual cost of caring for one person with Alzheimer's disease in 1996 was between $18,400 and $36,100, depending on how advanced the disease was and whether or not the person was at home. The cost of care has been steadily rising since then. The national cost of caring for people with Alzheimer's disease is now thought to be about $100 billion every year. The cost The cost of care is not only financial. Family, friends, and caregivers struggle with great emotional and physical stress as they cope with the physical and mental change in their loved ones. Caregiver must juggle many responsibilities and adjust to new and changing role. As the disease gets worse and caring at home becomes increasingly difficult, family members face difficult decisions about long-term care. The number of caregivers and their need will steadily grow as our population age and the number of people with Alzheimer's disease increase. Next, in question, how many new cases of Alzheimer's disease were there in 1995, and how many new cases might occur in the future? Research recently project the number of new cases of Alzheimer's disease that could occur every year over next 50 years if current population trend continue and no preventive treatment emerge. They estimate that the number of new cases every year will double between 1995 and 2050, from 377,000 to 959,000. Two factors will combine to cause in large increase. To one, the fact that the risk of Alzheimer's disease increase of people get older, and two, the growing number of older people, especially those over 85. The annual number of the new cases will begin to climb sharply around the year 2040, when all the baby boom will be over 65. Thank you. That's all from my explanation about Alzheimer's disease. I hope what I say is useful for many people. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Introduce myself, Farmasi. I'm from Stephen Padang. Hello everyone. This time I will discuss about obesity. All of you love to have a well body, or at least not to be obese, and we have the right to think like that, because obesity is not just cosmetic concern. It's also a risk for some health problems, such as heart disease, diabetes, and the high blood pressure on others. I'm sorry, it's look the gross, but don't panic. you can prevent your health problem easily, and you can lose weight through change the life and dietary style, increase physically activity and others. Uh, what what is obesity? Obesity that you have a high amount of fat in your body, and from that definition you can notice that obesity is not about more weight, it's about more fat. To understand this, you might weigh more because you are tall, and this is normal. Now with the BMI, you can diagnose yourself as an obese or not, but still one problem. Some people like the muscular until they find their BMI higher than normal, when they most likely have a normal amount of fat in their body, and their answer is that they weigh more not because of fat but because of musculars. What are the cause of obesity? Our daily body's activity net energy come from food we eat, and more exercise and activities burn more calories that we get from food, and not just the activities need to burn calories. Also, many metabolic reaction in the body need the energy from food, such as to warm up in cold water and to sweat in the hot day. But when our food calories among the exceeds the body need, they will be stored in the body as fat. So, cause of obesity is a combination of starts and risk factor that work together to store more fat in your body, and this factor include: number one, inactivity. With your activity, you don't burn as much calories, and you need to have more exercise to burn the excessive calories. Two, diets. Some bad eating habits like high calories diets, typically in the night, or skipping a healthy breakfast and replaced in by junk fast food. All of that increase the body fat. Next, pregnancy. Some women after the baby is born have an increasing in their weight, and if they don't lose that weight with many pregnancies after that, they might become obese. Next, lack two of sleep. They cause disturbances in the body hormone and increase the appetite. You also might crave to hack calorie food. Drug. Some medication let the body to gain more weight. There's drug include diabetes medication, steroid and beta blockers, anti-seizures medication, antipsychotic and medication, and antidepressant drug. Next, medical condition. Some diseases and syndrome let the body to store more fat and again weakly cleansing syndrome. Some diseases low the metabolic rate in the body and low the amount of burned calories every day, such as the hypothyroid and someone sees let the patient to lower his activity, such as the arthritis of maybe the patient with paraplegia. What are the complications of obesity? No, is obesity druggers? The answer is yes. Is yes. And if you are obese, you are at risk to have one or more of a great number of obesity health problem, including number 1, type 2 diabetes, high blood pressure, stroke, heart disease, gallbladder disease, osteoarthritis, poor wound healing, sleep apnea, high cholesterol and triglycerides, metabolic syndromes, cancer, and many other conditions. Moreover, the quality of life might be lower, and maybe you can do everything you want and like as easily if you want, like you can join some family activity, or you might feel some sense of depression. And this is a list of some weight-related status depressions, sexual problems, social isolation, physical disability, discomfort. And next, treatment. The Healthy Week is medical for obesity treatment, and you can raise that by making a good treatment plan. Your doctor and might be a big team of nutrition, the dietitians, obesity specialists, and nurse. This plan include dietary change, exercise and activity, behavior change, precision medication, weight loss surgery. Okay, friend, that's a little discussion about obesity. Wrong and outward, I guys. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sucinu Syafitri. I'm going to make a video about arthritis. Enjoy watching. Well, first I will explain the meaning of arthritis. Arthritis is inflammation that occurs in one or more joints, causing them to become stiff and difficult to move. Arthritis can be experienced by all ages, including adolescents and children. However, this condition most often occurs in people over the age of 65. Arthritis can be caused by many things. One of them is a buildup of uric acid crystal known as gout arthritis. Causes of arthritis. The causes of arthritis are different. Based on the cause, arthritis can be divided into several types, namely 1. Osteoarthritis. Osteoarthritis is inflammation of the joints caused by thinning and deteriorating cartilage. This condition will cause direct friction between the bones. 2. Rheumatoid arthritis. Rheumatoid arthritis is inflammation of the joints caused by an autoimmune disease in which the immune system attacks its own tissues. 3. Reactive arthritis or writer's syndrome. Reactive arthritis is inflammation of the joints caused by an inflammatory reaction that occurs in other parts of the body. This condition is often triggered by a bacterial infection that occurs in the urinary tract. 4. Septic arthritis. Septic arthritis or infectious arthritis is inflammation of the joints caused by a bacterial, viral, or fungal infection of the joints. 5. Gout arthritis. Gout arthritis is inflammation of the joints caused by the buildup of uric acid crystals in the joints. Men are more at risk of developing this disease. Apart from some of the possible causes above, there are a number of factors that can increase a person's risk of suffering from arthritis, including age, such as osteoarthritis, which is more common in people over 65 years of age. Gender. For example, gout arthritis is more common in men. History of disease, such as gout, infectious disease, or autoimmune disease. History of injury to the joints and obesity. Arthritis symptoms. Symptoms of arthritis will generally cause symptoms in the form of joint pain and stiffness in joint, swelling of the joints, limited motion of the joints, redness and warmth in the joints, reduction in the size of the muscle around the joints or muscle atrophy, and decreased strength of the muscle around the joints. Other symptoms that can be felt by sufferers of arthritis usually correspond to the underlying causes of this condition, including fever, if caused by an infection disease, feeling tired and weak with no clear cause. A friction sound appears when the joint is moved. Additional bone or bone spurs appear around the inflamed joint. A lump appears in the inflamed joint. Difficulty moving parts of the body that have arthritis. Diagnosis of arthritis. To diagnose arthritis, the doctor will first conduct question and answer regarding the patient of complaints and medical history. After that, the doctor will perform an examination of the joint to see any signs of inflammation and limited motion of the joints. To confirm the diagnosis, the doctor will carry out supporting examination in the form of blood tests to find out the cause of arthritis, whether it is an infection or an autoimmune disease. Ultrasound scan, X-rays, CT scans, and MRI to detect inflammation of the bones and joints. Joint foot analysis to find out if there is inflammation or infection in the joints. Arthrocentesis to detect signs in infection in the joints. Arthritis treatment. Arthritis treatment aims to address the causes, relieve symptoms, and improve joint function so that sufferers can continue their normal activities. Some the treatment options that doctor will give to treatment arthritis are drug. The administration of drug aims to treat inflammation and relieve complaints in the joints. Some types of drugs that are usually given are painkillers, such as paracetamol, capsaicin cream, anti-inflammatory drugs, or NSAIDs, and corticosteroid drugs to treat arthritis caused by autoimmune disease. Doctor can give disease-modifying anti-rheumatic drugs or DMARDs. Examples of DMARD drugs are hydroxychloroquine, chloroquine, or methotrexate. Complication of arthritis: sleep disturbance, depression on anxiety disorders, decreased productivity, osteonecrosis or avascular necrosis, foot deformity, osteoporosis. Arthritis prevention: maintain ideal body weight, always be active, move diligently, and exercise regularly. Maintain good posture when sitting or standing. Expand to consume fruits and vegetables and foods containing omega-3 fatty acid and chondroitin sulfate, such as sea fish and sea cucumber. Perform routine control if you have an autoimmune disease, gut disease, or an infectious disease that can increase the risk of developing arthritis. Thank you for watching. Assalamualaikum warahmatullahi wabarakatuh.